Hepatitis C treatments have come a long way since its discovery in 1989. According to the FDA, drugs used to clear the virus from the body were not only more effective than they once were, but also more tolerable for patients. Hepatitis is an inflammation of the liver that is caused by different viruses. In the United States, hepatitis C is the most common chronic blood-borne infection. Avoiding risky behaviors such as sharing drug needles can help prevent the spread of the disease. But there is no vaccine for Hep C. Over the summer, I brought you this story explaining the disease. An estimated 1 in 30 baby boomers have hepatitis C, and most don't even know it. People live with it for years or even decades with no symptoms, while the disease slowly damages their liver. By the time symptoms do appear, liver damage is often advanced. Dr. Garth George of Advanced Gastroenterology and Surgery Associates tell us what we need to know about Hep C and how to find out if you've been exposed to this silent epidemic.
Hepatitis basically means inflammation of the liver, and there are many things that can cause hepatitis. First off, most people think of the viruses when someone says hepatitis, but the list of things that can cause inflammation of the liver are extensive. Not just viruses, but alcohol, medications, some diseases. However, most people concentrate on the hepatitis viruses. Of the viruses, there are approximately 5 hepatitis viruses, A, B, C, D, and E. The one that's causing the most difficulty right now is hepatitis C. What we've observed over the past few decades is that people born between 1945 to 1965 have 5 times the incidence of hepatitis C than people born in other decades. Hepatitis C is spread mainly parenterally, so you have to be exposed to blood. So previous intravenous drug abusers, patients who've had blood transfusion prior to 1992 are high risk. And then there could be some subtle times of transmission in healthcare professionals who get exposed to contact with blood that's tainted with hepatitis C. The vast majority of patients with hepatitis C are what we call asymptomatic. They have no idea that they have the virus. You know, they may have very mild fatigue, sort of mild myalgias, somewhat like the common flu. However, the vast majority have no symptoms at all. And that is why many of our patients, we ultimately diagnose them when they already have advanced liver disease with cirrhosis. Patients will come in with complications of cirrhosis and found to have hepatitis C, and they never knew that they had it, and they were probably exposed to the virus 20, 30 years ago. So it's a very silent disease. It's the biggest reason that liver transplantations are done in this country. So the risks of having hepatitis C are cirrhosis of the liver initially and its complications thereof, as well as the development of cancer of the liver. It's a very slow process. Every primary care doctor probably has about 40 patients with hepatitis C that's not diagnosed. So the focus is on the primary care physicians to start testing their patients for hepatitis C, regardless of other risk factors that we normally follow. So right now, hepatitis C is a significant healthcare burden. It's probably estimated about $3.3 billion a year. And so we're trying to improve that.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the Help for Hep C Story link icon on our homepage, yourhometownhealth.com.